I'm Dr. Sewchand. I'm currently completing an observation at the North Alabama Medical Center in Florence, Alabama. This presentation will be about ocular syphilis in a patient with secondary syphilis. So as you can see on the poster there, named it Keep Your Eyes Open. So in October of last year, I was observing Dr. Lesley Balbirnie and Dr. Renato Ferrandiz, who are residents at the North Alabama Medical Center, as they were making rounds. That morning, a 43-year-old Caucasian female was admitted with progressive right eye pain associated with blurry vision and black spots in her field of vision. On examination, patient had mydriasis and multiple non-itchy 5 to 10 millimeter macules on her face, trunk, and extremities. So the patient was taking spironolactone, or history of spironolactone, 25 milligrams daily for hypertension, and NSAIDs over the counter. She mentioned having 3 sexual partners in the past 8 months without barrier contraception. There were no prior history of blood transfusions, diseases, or immune diseases. So the patient was seen by an ophthalmologist who described a tough view of the posterior segment of the right eye with associated posterior syncytiae of the iris, in which the iris adheres to the anterior lens capsule in the right eye. The left eye was unaffected. So the patient was started on a dose of triamcinolone, atropine sulfate in the affected eye twice a day, and daily prednisolone in both eyes without improvement. So the patient was given an RPR test, which came back positive for treponema pallidum antibodies. She was also positive for Hep C antibodies. HIV serology was negative. So the patient was hospitalized and a lumbar puncture was done as the patient started complaining of headaches during hospitalization, but the CSF analysis was normal. The patient was started on aqueous crystalline penicillin G, 4 million units IV every 4 hours for a total of 14 days. The patient noticed an improvement in vision and the papules decreased in size. The patient's partner was also counseled for outpatient treatment. The patient was discharged on 24 million units daily, or divided into 12 units every 12 hours as continuous infusion. As far as the ocular manifestations of syphilis, so we know there are 4 stages of syphilis: primary, secondary, latent, and tertiary, which is also tertiary is neurosyphilis. The ocular manifestations of syphilis can occur at any of these stages of the disease with varied clinical presentations. It can involve almost any ocular structure, but posterior uveitis and panuveitis are the most common presentations, usually unilateral, and if untreated, could lead to blindness. In 2020 alone, 133,945 cases of syphilis were reported in the US. A total of 12.7 primary and secondary syphilis cases per 100,000 were reported in 100,000 people were reported in Alabama, with increasing cases each year. Syphilis is a very versatile disease and should be considered before starting treatment in a patient with otherwise unexplained unilateral acute vision loss, especially compounded by skin manifestations. In this case, uveitis appeared days before skin manifestations. Point of care tests could be done if there is high suspicion, and treatment should be started as soon as possible. As you can see on the slide here, we took with the patient agreed on her picture being shown. You can see her right eye. She has mydriasis. You can't really see much else, but the photo was taken when the eye was not under the influence of mydriatics. As a result of right eye uveitis, the dilated pupil had resulted. It's worth mentioning that the right pupil constricted when patient focused vision on nearby object. So that concludes the case that we encountered. Are there any questions?
We touched on there was a perception of visual acuity improvement in the patient over the course of their 14-day treatment. I'm curious, what do we have a specific number in terms of like the visual acuities return, given that it was at 2800 at the peak of the uveitis?
Oh, sorry. Wait. Patient was seen by ophthalmologist. So you're asking how quickly? Sorry.
I'm curious how quickly visual acuity returned, I suppose.
As far as because I was observing them only for the first week, but I tried to get that info from them. As far as I know, the patient within the first few days of starting the penicillin, she noticed improvement in vision in papules. Sorry, I can't give you exact days. I couldn't get that info, but I know it was within a few days, and then by the 14th day, I'm pretty sure she just went off the penicillin and she was fine.
Okay, wonderful. Thank you. I was just curious how quickly, I guess, the
Yeah, sorry.
Yeah. Oh, no. It was just for my own curiosity, I suppose. Are there any other questions for this case? All right. Well, thank you again very much for presenting today.